I'm Sherry Boschert at the Transcatheter Cardiovascular Therapeutics meeting in San Francisco, where Dr. Michael Mack spoke with us about the CoreValve pivotal trial and how clinicians would choose between CoreValve and the SAPIEN valve.
So the most important was the primary endpoint, which was mortality and stroke, and significantly better than the objective performance goal that had been constructed. Now, the objective performance goal was the PARTNER B results with the SAPIEN valve in inoperable patients, and they easily met that primary endpoint. So that was very much a positive out of the trial, and very encouraging. Here's how I would think about it right now. Do I want to have CoreValve on my shelf? Well, yes, of course. You, as a clinician, you always want more than one option. Our experience is all Edwards SAPIEN, and I have no Medtronic CoreValve experience, so I haven't had hands-on, and therefore, can't speak from an experience point of view. Having said that, who would I use the CoreValve device in? I would say, first of all, anybody with vascular access issues. The lower profile delivery system, being 18 French, certainly allows us to treat some patients that we either can't treat with the Edwards valve, or we have to treat by an alternative access approach. The second would be patients who have a large annulus. Right now, the largest valve we have is a 26 valve with the Edwards valve, so a 31 millimeter CoreValve would be a significant complementary tool to be able to treat patients that we can't treat now with the Edwards SAPIEN device. The concern, however, if I have a patient that's equal on both front and could be treated with either, is which one would I use? So on the positive side, the paravalvular leak seems very low with the CoreValve device, but our experience with the Edwards valve is that our paravalvular leak is lower with that than what was in the pivotal trials, due to the fact of CT sizing and right sizing of the annuli. But then on the negative side for CoreValve is the pacemaker implantation rate. So with a 22% pacemaker implantation rate, with a 5% for the CoreValve and a 5% with Edwards, that's not insignificant. So you would have to ask, how important is that to clinicians as a differentiator between the two valves?